Morning, everyone. Thanks for coming. Today is April 7th, and it's the World Health Organization's World Health Day. And today the focus is on antimicrobial resistance and its global spread. And so the WHO's theme is antimicrobial resistance, no action today, no cure tomorrow. So we're here today to discuss the continued presence and danger of superbugs within the NWT. A superbug is a microbe, bacteria, or virus that has resistance to the drugs that was once used to treat it. Superbugs are sometimes bacterial infections that are resistant to antibiotics. And an example of a skin superbug would be MRSA. The long name of that is methicillin-resistant Staphylococcus aureus. These skin superbug infections have the potential to become severe and even life-threatening if not treated properly. While superbugs used to be associated more with hospital-spread infections, they've now moved beyond the hospital and into the community. In the NWT, there's a particularly vicious strain of the superbug that causes the majority of MRSA skin infections. Superbugs can cause simple skin infections to complicated skin and soft tissue infections. Superbugs can also infect the body's organs and blood. Superbugs are everywhere and can live on anything, and even healthy people can experience superbug infections. Prevention is the best way to reduce the likelihood of acquiring a superbug-related infection. It is important to practice good hand washing and good hygiene, and to know the signs and symptoms of a superbug infection and how to care for it. I'll now introduce emergency room physician Dr. David Pontin from Stanton Territorial Hospital, who will discuss superbug infections from a clinician's perspective.
So listen, thank you everybody for coming today. I was asked to come here by Dr. Candela just to provide, I guess, on the ground clinical perspective of what it's like to be dealing with this issue. And there's an additional public health thing I just think I want to start with. And you know, community-acquired MRSA has been around for probably a decade or 15 years or so. And this bug is a monster, you know, and it's a monster essentially that we created. And by we, I mean the medical, Western medicine world. And we created it essentially by using antibiotics indiscriminately, particularly for things like colds and flus, okay? So one of the important public health messages here that I think we have to understand is that when we see people in an emergency room setting every day, all the time, for people with colds and flus who want to be treated with things, the reason that we don't use antibiotics, and we're very, very careful not to, is particularly because of this problem. So community-acquired MRSA is the result of indiscriminate antibiotic use in a number of areas all over the world, okay? Fortunately, NWT has actually been a bit of a late recipient of MRSA. It's been a big problem down in the south for a long time, both in southern cities of Canada, but also the United States. The prevalence of community-acquired MRSA up here has sort of exploded in the last couple of years. And we went from seeing very, very little community-acquired MRSA on a day in the emergency department to a situation now where approximately half of all of the soft tissue and skin infections that we're seeing are community-acquired MRSA. So what does this mean? This means that the treatment options that we have for this drug, or for this bug rather, are rather limited. We still have a lot of antibiotics that we can use, but they're certainly not the standard ones, okay? So we have to start thinking obviously a little bit differently in the emergency department when we see these patients that this could be community-acquired MRSA, and we have to treat it differently. The other issue, frankly, and this is what Carolyn was alluding to, is that this particular bug, and in the particular strain of this bug that we have, and this is MRSA 10, right? We call it MRSA, it's sort of the shortened version of it, but MRSA 10 is a particularly nasty cousin of this group. So what this means is that we see a lot more serious infections from this than other strains